As a graduate student at MIT, I worked with a couple other people at MIT to study Pratham and their remedial education program in India. It was a randomized controlled trial, so you put 300 classrooms and you offered those children some tutoring, and you had 300 classrooms that served as a comparison group, and you showed that you actually have very high gains in learning. And then that, combined with a bunch of additional research, tons of work from JPAL, from governments, from international organizations, helps change primary education around the world and advance this sort of teaching at the right level movement, which has tried to refocus education to meet the students where they are, and has affected tens of millions of kids inside and outside India. But that took 20 years to do, from sort of the first innovation by Pratham up to the policy work. And I think there's a lot of hope that the arrival of digital services and digital data collection can reduce that iteration cycle and speed the spread of technologies super rapidly. And so I'm going to talk about a similar project that I've been working on for about 5 years. And in some sense, it's kind of a cautionary tale, because I showed up thinking, okay, we're creating a new organization. We talked about creating new organizations in the previous panel. Michael Kramer, a Nobel laureate, is on the board. We've got data scientists from Google. We've got the top experimentalists from JPAL helping us. And it's just going to be grand. And this is a nonprofit that does many things, but one thing we tried to do is use data to provide better fertilizer recommendations for farmers. And so the vision was, the government of India has announced this initiative to collect plot-level soil tests from millions of farmers. We can combine that with analytics and experiments to provide guidance to farmers. So this is an example of a soil health card that's provided to farmers that tries to give them guidance on what they should do in terms of the primary soil nutrients. That will then affect outcomes. We can use satellites or other low-cost ways to collect data and again, build an iterative system to dramatically improve soil nutrient management. And what we found out was that this was pretty hard to do, despite seeming relatively like a no-brainer from a product perspective. So we did a randomized controlled trial in Gujarat. Again, took 800 farmers where we offered them this soil advisory, and 800 farmers served as a comparison group. And we followed them over a couple years to see how it affected their farming behavior. So the first lesson, I think, was one that they don't teach in a PhD in economics, which is about the importance of human-centered design. So there had been previous work by Ram Fishman in Bihar evaluating soil health cards, and it found that there was no effect on fertilizer use. So this was a pretty high-touch intervention where government agronomists went to the households, to the farmers, gave them their soil health card, explained it, said, do you have any questions? This gives you guidance on what you should do. But in fact, farmers just didn't change their behavior. They weren't more likely to use micronutrients, and they didn't change their quantity. And basically they decided, maybe this isn't the most effective way to communicate with a smallholder farmer in India, to give them a technical page of information with 60 data points. And I think we heard this again early in the panel, that there's often, the perfect ends up being the enemy of the good, in the sense that the bureaucrat says, well, we have to give them this information and this information and this information, and we wouldn't want them to make a mistake because we forgot to give them this information, and the user just becomes totally overwhelmed. So one of the first things our nonprofit did was to say, can we find better ways to just deliver information to improve comprehension, right? Because having the data is not enough. You need to deliver the data in a way that people trust it and believe it and are willing to act on it. So we did a simple experiment with about 1,500 farmers, and we first showed that if you give them the soil health card, less than 10% can figure out what they should do with that data, right? It's just too hard for them to process that. Even though the recommendations are given there, it's just too hard. So what we did is we gave them, we had 4 groups here. One group just got those soil health cards. Only 10% could understand that. One group got audio messages delivered in addition to the soil health card. Hi, I'm an agronomist, and I'm going to explain the soil health card to you. If you look on the first panel, you'll see this. One group got video messages, and one group actually met with agronomists who walked them through the soil health cards. And we showed that audio and video supplements increase comprehension by about 50 percentage points. So from about 10% to about 60% understanding what they should do on a hypothetical farm in this study based on the soil health test. But I would say that academics and governments are not well placed to conduct these iterative evaluations in design. Like, it took us a lot of work and a lot of effort to get there in a way that I think the private sector might have been able to figure out what's the key message, let's distill it, and let's deliver it quite quickly. On the other hand, we also learned that the data themselves might not be reliable, right? So I think there's a lot of excitement about the large population in India, large amount of data. We conducted our own set of systematic soil tests and compared those to the government soil tests and found essentially zero correlation between what the government was reporting in terms of soil nutrient quality and what we tested. Now, you might say maybe our tests were terrible, but we actually double tested a bunch of plots, and we found a strong correlation between two independent teams of our own that tested those plots. So it's hard, as many of you know, quite negative or critical by nature, perhaps. The third lesson was that, yes, despite all these challenges, these data-driven interventions can change behavior. So we distributed the soil health cards. We provided 11 timely customized voice messages that reminded the farmers, in a week it's going to be time to go to the market and buy your fertilizer. We tested your plot. We know your plot area. We think you need to have about 2,000 rupees ready to get your basal fertilizer content. The listening rate to the calls was pretty high. The treated farmers were subsequently more knowledgeable about how much fertilizer they should be putting on their plots. And, sort of most importantly, they were about 20 percentage points more likely to apply this appropriate level of fertilizer to their farms. And so this was sort of and you might think even here, like, okay, we can declare victory. We figured out how something works. But no, I think we're still doing R&D on this product and service. We're still talking to governments about thinking about how to improve their service delivery. And it's, again, a setting where a sort of a multi-party sustained effort is going to be necessary to bring this type of intervention to scale. So, I think this is not news to anybody. It's hard to argue against this, but I think, and especially relevant to academics. Academics tend to roll their eyes or glaze over when the deans show up and talk about interdisciplinary work, right? Because we make our fame and our fortune by becoming the best economist in the field of economics, and we care about what our peer economists do. But I think I see this in the program designed by Data.org as this understanding of the importance of disciplinary work. And I think data scientists are actually quite eager and interested to recognize that they have some amazing, unique tools, but they also need to work with others, such as social scientists or cognitive scientists, to figure out how to get the data to translate to that last mile of behavior change. So as we think about how we're supporting faculty and how we're supporting students, we might want to keep in the back of our mind that different parties are bringing different things to the table in this theory of change from data to outcomes. Governments and firms often have a large scale to be able to do data collection at relatively low cost, but it tends to be the academics who are going to drill deep into the data and make sure that the data are not nonsense, and also have perhaps the best thoughts on how to come up with a credible research design, so we don't end up investing $100 million in a product that sounds amazing but isn't very effective. On the other hand, it's going to be firms or social entrepreneurs who do the product design and intervention. Maybe we'll see the NGOs doing data analytics thanks to this program, and then we'll have to probably rely again on governments and firms for delivery at scale. So those are my perspectives, and I look forward to learning from the rest of the day's